Welcome to the Medication Safety Initiative designed for correctional facilities by the ONE program. We are very excited about the collaboration with you and the ONE program. The ONE program stands for Opioid and Naloxone Education. It began in 2017 in community pharmacies across the state of North Dakota. Pharmacists have been screening patients for the risk of opioid misuse and accidental overdose potential with every opioid prescription that has been dispensed. However, this is only happening in a handful of pharmacies across the state, and we are missing a large percentage of our patients that are in need of screening for medication and opioid safety. The ONE program set out to bring further interventions beyond the opioid crisis related to medication safety. These topics include medication disposal, medication adherence, medication storage, safe use of pain medications, and now diversion through our collaboration with North Dakota Correctional Facilities. Through this initiative and by watching this training, you will be able to provide screening for your patients and interventions. We suggest doing these screenings at the time of incarceration and providing educational materials and interventions for patients to keep in their locker or storage area for when they are released. The interventions that you can provide include education, daily pill organizers, medication disposal products such as Deterra or DisposeRx, a medication lockbox, a 1 in 4 brochure, and naloxone. We will talk about these interventions further throughout the training. This medication safety initiative will incorporate 5 interventions focusing on medication storage, safe medication disposal, adherence to medications, medication diversion, which is illegally obtaining medications, and the use of pain medication safely. This is a graphic representation of the entire medication safety program in a snapshot. Essentially, for every single inmate, you will perform a medication safety questionnaire. This is step 1 on the graphic. It will have 5 primary questions, and based on those questions, you will provide education about medication storage, disposal, adherence, and diversion. After this, you will complete step 2 of the graphic, which is completing the opioid risk tool assessment with the patient. This risk tool assesses the patient's risk for opioid misuse and accidental overdose. Following completion of the risk tool, you will discuss the risk results with the patient and provide the medication safety kit. This kit includes a disposal bag, a Deterra bag, a daily pill organizer, a 1 in 4 brochure, and a locking medication bag to store all materials. Additionally, the patient should be offered naloxone and provided naloxone education. After providing patients with the 2 screenings, appropriate education, and intervention materials, you will move to step 3 and complete the outcomes worksheet outlining which education and interventions were provided to the patient. We will further discuss each of these components in the upcoming slides. The first step is completing the medication safety questionnaire for each and every patient. This offers an opportunity to educate the patient based on their individual responses throughout this questionnaire. Patients' answers will be documented on this form or through the electronic form and entered into the REDCap documentation system. This questionnaire consists of 5 questions. How does the patient typically store their medications? How does the patient typically dispose of unused or expired medications? Does the patient ever forget to take their medications? Has the patient used someone else's or given their medications to someone else before? Does the patient take medications for pain or opioid use disorder? The first question asks about how the patient stores their medications. We will focus on this for our first initiative. The first option is storing in a medication lockbox, which is ideal for all patients in all settings. However, it is not necessarily feasible. We will be providing medication lockboxes for patients who have an opioid medication. The second option is medication is stored in a safe, designated area. This would be in a cool, dry place out of the reach of any children or pets. We also want this to be out of sight to any visitors in the home. The third option is an unsafe, designated area. Examples of this would be inside a nightstand drawer, on top of a nightstand, or a kitchen counter, which would be in the view of visitors and accessible to children or pets. We also want our storage area to be cool and dry, so medicine cabinets within the bathroom are not the best option as changes in temperature and humidity can result in degradation of the medication. The last option is not having a designated storage area. Oftentimes, patients have medications in various areas throughout their home, which is something we want to avoid. Remember, we want our patients to store in a cool, dry place out of reach of children or pets and out of view of visitors in the home. Next, we will talk to patients about disposal. The first option is medication is not discarded. This means the patient has a stock of medications that may be unused or expired. Next, medication discarded in the trash is not our best option. Medication disposal with approved measures, which could be things like Pharmacy MedSafe, which is boxes throughout our North Dakota pharmacies where you can drop your excess medications off, our local public health unit, our police station, kitty litter, coffee grounds, or other medication disposal products like doTERRA and DisposeRx. I do suggest providing all of your patients with the medication disposal products such as a doTERRA bag. Please consider providing this to patients who have unused medications on hand as we are able to supply these through our grant. The next topic we will talk about to our patients is medication adherence, or using medications as prescribed and not forgetting to take specific doses. Does the patient forget to take medications? Never, occasionally, or frequently are the options. Remember, medications are only as good as the adherence of the person using them. For example, if a medication is dosed twice a day and the patient is only taking it once daily, they are only at therapeutic level for half of the amount of time. Patients overusing medications can cause harm, so it is important to take them as prescribed. The main obstacle is remembering to take medications. A pill organizer can greatly help this, especially for patients who have cognitive or memory issues. We can also encourage them to set phone alarms to remind them of their dosing regimen. For example, they can set an alarm at 8 a.m. and 8 p.m. for medication that is dosed twice daily. The next question is a response to diversion. Has the patient used someone else's or given their medications to someone else before? The responses are patient has diverted a prescription medication at least one time, patient has been approached with request to divert their medication at least one time, and patient has taken a diverted medication at least one time. It is imperative our patients use their own medications, not others, and do not give their medications to other people. With the opioid crisis, diversion is one of the top reasons patients are using medications in an unsafe way. When you provide education on this topic, it will be important to remind patients to not take medications that are not for them and to never share their own. Pharmacists and prescribers work very hard to ensure medications are safe and effective for them, but this does not translate to other people based on their conditions, age, family history, and other medications they are currently taking. The last question asks if they are taking medications for pain or opioid use disorder. This is a simple yes or no question, but if they are using a medication for pain, we would like to know if it is an opioid or not. Non-opioids include things like Celebrex and over-the-counter NSAIDs such as Tylenol. Opioids can be things like hydrocodone or medications used for opioid use disorder like Suboxone. Then we will move into the opioid risk screening tool to evaluate the safety of opioids for this specific patient. Up to this point, we have learned about the 5 prime questions of medication safety. After every single client completes the medication safety questionnaire and received education on all 4 medication safety topics, the next step is the one program opioid risk screening tool. Every single client will be screened for risk of opioid use whether they answer yes or no to taking opioid medications for pain in step 1. This objectively screens the patient for the risk of accidental overdose and opioid misuse. This is a snapshot of the opioid risk assessment. You will notice that there are 3 sections: opioid misuse risk assessment, accidental overdose risk assessment, and medications for opioid use disorder or MOUD history. The top portion is the opioid risk tool or the ORT. Notice that there is a female column and a male column for scoring. This would be the gender that the patient was born with, not the gender that they currently identify with. Note that it may be the same, however, if they identify with a gender that is not their birth gender, please use the birth gender for this portion. The middle portion collects information from the patient to see if there are any diseases or medications that would contribute to the risk for respiratory depression, which may put them at risk for accidental overdose. Finally, the bottom portion identifies if the patient was previously or currently treated for an opioid use disorder and if they would be interested in starting or continuing medication therapy while incarcerated. This is the opioid risk tool, otherwise known as the ORT. The ORT has been validated with individuals in pain clinics to identify patients that may be more prone to developing an opioid use disorder or may be more prone to misusing opioid medications. If you look at some of the screening criteria for the ORT, you will notice there are different scores given based on their birth gender. We look at the patient's family history of substance abuse with not only alcohol, but illegal drugs and prescription medications, the patient's personal history of substance abuse, their age. Individuals between the ages of 16 and 45 are most likely to misuse opioid medications, and if the patient has a history of pre-adolescent sexual abuse. Females in particular who have experienced this have a greater risk for misusing opioid medications. Then looking at psychological diseases, individuals with ADD, OCD, bipolar disorder, schizophrenia, and depression all have a greater risk of misusing opioid prescription medications. Depending on how their score adds up, they are considered at low risk for opioid use disorder if they score 0 to 3, moderate risk for if they score 4 to 7, and they are considered high risk if they score 7 or more. Look at the middle portion of the form assessing for accidental overdose risk. Any yes answer is indicative the patient is at risk for accidental overdose. These answers are also additive, so if there is more than one yes answer, the risk does increase. Some of these risks are listed here. Any patient using a long-acting or high-dose opioid are automatically at a higher risk of accidental overdose. Patients who use alcohol or non-prescription sedatives such as Benadryl are also at a high risk. Stopping and restarting an opioid can increase your risk for accidental overdose. Medications such as gabapentin to treat nerve pain or benzodiazepines or other prescription sedatives, in addition to an opioid, can drastically increase their risk for accidental overdose. Sleep apnea is an increased risk because the patient already has decreased respirations. The mechanism for an overdose is actually related to respiratory depression. Underlying kidney or liver disease increases the risk due to the way our bodies clear opioid medications. Those over 64 are at a greater risk due to metabolic changes that compromise the way our medications are used within our body. Any one of these answered yes means the patient is at risk of an accidental overdose. The more yes answers means the patient is at an even higher risk for accidental overdose. Now that we have learned a little bit about what can lead to risks for accidental overdose or opioid misuse, I wanted to point out a few medications that may be extra risky for patients who are using opioids. At no point do we expect you to make recommendations for a new medication. We would definitely leave that up to the expertise of the pharmacist or provider. But we do want you to be aware of some medications that give an additive risk to accidental overdose, even for our patients who are using their opioid medications exactly as prescribed. These medications, when used with opioids, increase the risk of respiratory depression, which ultimately could lead to accidental overdose. Benzodiazepines such as lorazepam and alprazolam. These two have the most evidence to suggest a high risk of overdose when used with an opioid. We also have gabapentin and pregabalin, which are medications used to treat nerve pain. Sleep aids such as zolpidem or even over-the-counter diphenhydramine-containing products such as Advil PM or Tylenol PM can increase the risk for accidental overdose when used with an opioid, as well as muscle relaxants such as cyclobenzaprine. So this is just taking extra care of our clients, and when you see they're on one of these types of medications, in addition to their opioid, you should recognize that they are at an increased risk for an accidental overdose. So far, we have completed Step 1, our medication safety questionnaire, and Step 2, the opioid risk tool with every single patient. Regardless of their risk, all patients are able to receive all components of the medication safety kit. Remember, this includes the medication lockbox, a 1 in 4 brochure, daily pill organizer, naloxone, and medication disposal products such as a Deterra bag. Now, the third and final step is completing the outcomes worksheet. This documents what education and interventions were provided to the patient. The education section asks about storage, disposal, adherence, and diversion education provided to the patient. As said previously, each patient should receive education on all 4 subjects regardless of their answers to the medication safety questionnaire in Step 1. The second section asks about which interventions were provided to the patient as part of the medication safety kit. As a reminder, all patients can receive components of this kit, including the disposal product, pill organizer, naloxone, 1 in 4 brochure, and medication lockbox, regardless of their risk for opioid misuse or accidental overdose, determined by using the opioid risk tool. Please note, within the intervention section, there are 2 questions asking if the patient was identified for accidental opioid overdose or misuse. This will not always be yes for each patient, so please fill it out based on the ORT score and yes answers found in Step 2. This slide outlines the entire workflow from start to finish of this medication safety initiative. The first step is to complete the medication safety questionnaire. This screens whether the patient is using their medication safely and correctly. Following completion of that, you will provide education to all patients on all subjects. The subjects are storage, disposal, adherence, diversion, and proper use of pain medications. The next step is to screen the patient using the opioid risk assessment tool. As a reminder, the risk assessment consists of 3 parts. The first is opioid misuse section, which screens the patient for opioid misuse. The second section is the accidental overdose risk assessment, which screens the patient to identify the risk of an accidental overdose. The final section is the MOUD history section, which identifies if patients have previously been or are currently being treated for OUD, as well as if the patient is interested in starting or continuing OUD treatment while incarcerated. Following completion of the opioid risk assessment, you will discuss the risk results with the patient and provide the medication safety kit. All patients can receive all components of the medication safety kit, regardless of their risk of opioid misuse or accidental overdose. After completing the opioid risk assessment and providing these interventions, you will complete Step 3, which is documenting the outcomes. You will document this information on the outcomes worksheet, which asks which education and interventions were provided to the patient. It also asks whether the patient you screened was at risk for accidental opioid overdose or opioid misuse. Finally, you will take the results obtained through the medication safety questionnaire, opioid risk assessment, and outcomes worksheet, and you will input these into REDCap. Now that we have discussed all 3 steps of the medication safety initiative, we will walk through an entire example together. The first step I would do with my patient is complete the medication safety questionnaire. Fill out their name or MRN. As you can see, my patient answered they store their medication in an unsafe designated area. This could be somewhere like the nightstand, on top of a nightstand, or kitchen counter that is accessible to children, pets, or visitors. The second question, inquiring about disposal, my patient indicates they dispose in the trash. They say they never forget to take their medications, and they have taken a diverted medication at least 1 time, indicating at least once they have used a medication that wasn't prescribed to them. Finally, they said they are not currently taking a medication for pain or opioid use disorder. On this slide, I have starred the medication safety topics I would be sure to focus on based on my patient's responses to the questionnaire in Step 1. They indicate storing in an unsafe place, so I would educate them a safe place is a cool, dry place out of reach from children, pets, and visitors, and teach them how to use the medication lockbox. My patient indicated throwing unused medications in the trash, so I would provide education on the harms of doing so and provide proper medication disposal such as Deterra bags or DisposeRx, or informing them of medication take-back boxes. They indicated using a diverted medication at least 1 time, so I would explain that providers and pharmacists work hard to ensure medications are safe and effective for the person it's prescribed to, but that doesn't mean it is for everyone. Finally, although the patient doesn't forget to take their medications, I would still emphasize the importance of taking their medications as prescribed. The second step is to complete the opioid risk assessment tool. This patient indicates they have taken an opioid medication within the last 60 days. Then I move on to ask my patient about their family history of substance misuse, personal history of substance misuse, history of pre-adolescent sexual abuse, and any psychological diseases they may have. I will add up their score based on their gender, and reminder that this is the gender the patient was assigned at birth, not the gender they identify with. We then move on to the middle section and circle items in their medical history, medications they are using, and then we finish with the MOUD history section. This questions whether they are currently in treatment, have previously or currently taking medications for OUD, and if they are willing to continue or start a medication for OUD while incarcerated. As you can see, after adding up my patient's score based on their answers, it is 10. This patient is at a high risk for opioid misuse. It is extremely important to educate this patient on the risks of opioid misuse. This patient doesn't have any disease states in his medical history that would put him at an increased risk for accidental overdose. However, any medication or substance circled in the second question would have an additive risk to an accidental overdose. This is important to note as we often educate the patient about naloxone. The MOUD history section shows this patient has never been treated for opioid use disorder, so the question asking about continuing while incarcerated isn't applicable and we skip to the last question. This patient indicates he is willing to take the medication if it is prescribed and available for him. These questions are by request from the state of North Dakota to learn more about how frequently inmates would desire treatment with medication for opioid use disorder within the correction system. After discussing the risk results with my patient, stating they are at a high risk for opioid misuse, educating them, and informing them of their increased risk for accidental overdose, I would provide the medication safety kit to them. In this kit, I would provide the medication lockbox, 1 in 4 brochure, daily pill organizer, naloxone, and a Terra bag. But just a reminder that regardless of the patient's risk for accidental opioid overdose and opioid misuse, patients can receive all components of the medication safety kit. Now I will move on to step 3 and complete the outcomes worksheet and indicate I educated the patient on all 4 areas of storage, disposal, adherence, and diversion. The interventions section asks which components of the kit I provided to the patient. My patient decided to accept all 5 parts of the medication safety kit. Additionally, I will indicate my patient was screened and identified to have an increased risk of accidental opioid overdose due to their disease state and current medications, and was also identified for high risk of opioid misuse due to his score of 10. Not all outcomes worksheets will have yes circled for each question. There will be times where there are no yeses circled. This is an image of our medication safety kit and all its components. Just to note, the naloxone is not provided and will have to be added to the kit upon arrival. From left to right, we have the pill organizer, the Terra bag for disposal, our 1 in 4 brochure discussing opioid addiction, and the medication lockbox is under holding all of these components. This is an example of our 1 in 4 brochure. I would suggest taking a look and familiarizing yourself with the small brochure. This is a very straightforward way of illustrating to our patients the risk of opioids for those receiving long-term opioid therapy. Oftentimes, this is an aha moment for our patients. They may realize that even though their pain can be managed while taking an opioid, the risk of being on one may not be worth it, as 1 in 4 people end up struggling with an addiction. So familiarize yourself with this tool. This was created in collaboration with the North Dakota Department of Health and Human Services and our North Dakota State Board of Pharmacy. To finish, we want to leave you with some tips for success. First, we suggest screening each person at the time of incarceration or as soon as possible. Then, when educating patients about safe medication storage, remind them we would like it out of the reach of children or pets, out of view of visitors, and in a cool, dry place. For medication disposal, we would like to provide a Terra bag and suggest medication take-back events at the pharmacy, police station, or even local public health units. For medication diversion, we can educate them that prescription medications are ordered by doctors and prepared by pharmacists for a specific person. The dose, quantity, or action of a medication that can help one person may cause serious harm for another. Therefore, do not share your medications or take medications that are prescribed for someone else. And remind them of safe storage habits to prevent others from taking their medications. Finally, for opioid safety, it is important we offer tools such as the medication lockbox, 1 in 4 brochure, daily pill organizers, and naloxone along with education. That concludes the One Program's Correctional Facilities Medication Safety Initiative training video. We are so excited to have this collaboration with you and would love for you to reach out with any questions you may have. Thank you.